just not come down off a cloud. So here we are in the clouds. So we're here today, and we're going to take some time to talk about this RFP that they're talking about at the SRC. It's 52 pages. I'm sure if I ask for a show of hands, most people here haven't looked through the 52. I can't say that I read every line of the 52. So the idea, if we can, it's complicated because they're just kind of throwing something out and hoping something will stick. But they're looking for any opportunities, small or wholesale, to figure out a way to decimate the program that the school nurses have had operating in Philadelphia for over 100 years. A program that was fully functioning, and you never heard a complaint about it, and you never heard research, and you never even heard the famous so-called failed school theory. You never heard about failed school nursing. Now we know why they call that failed school. That's a euphemism for poverty and things that, you know, most of us don't consider our schools failing. But I don't think anybody here ever thought that the school nurses' services provided to the kids were failing. That was not even a question. So it's really shocking that the problems with the nursing only started when they decided to let go of the nurses. And now they're coming up with some pseudo solutions that we have serious issues with. Of course we have issues that our jobs are at stake. Of course anybody with credentials and jobs wants security in their lives. But the huge issues are even beyond that. They have to do with what's going to happen to these kids when they come up with really a bogus plan that's like a win-win, win for the school district, win for some venture capitalist, but lose-lose for the kids. The nurses who know these communities, who've been in these communities, who are in this for the long haul, we're not having any of it. We're going to talk with each other about it. We're going to teach each other, and we're going to speak to the press. We're going to speak to the communities. We're going to speak to our newly elected officials that'll be coming on. And we are not going anywhere. It's great. Our next speaker is Peg Devine, and before she comes up, I just want to put a shout out to Peg, because no one knows the amount of work that Peg does on the sidelines to support the nurses. You know, we used to have 5 nurse supervisors, they called them, until they pulled that out from under. Now we're supervised by people who aren't professional, our principals. Not a good thing, another topic. But we have 1 nurse coordinator, and we have a nurse who is so devoted that she helps fill in a lot of the role of the former supervisors. It's Peg Devine. She also has had the School Nurse of Pennsylvania award appropriately given to her. She's just the best. She's a fabulous colleague. She's a great friend, and we've done this whole fight together, and I'm going to give the mic to her to have something to say.
Thank you, Eileen. You said so much that was so important, and Helen, you also said so much that was so important. Now, what I want to talk about is the cash cow of privatizing and outsourcing the nurses. And what happens is you've got venture capitalists who want to come in, and they see so many of our students on Medicaid, and they say, oh, we can bill for service. This is a great idea. They're doing it with the dental programs. The dentists come into the schools. They see students who have insurance, and they get x-rays, and they get sealants, and they get a cleaning, and they get a dental exam, and if need be, they get fillings. And then the kids who don't have insurance get looked at and get told to go to the dentist. So this is pulling kids out of the classrooms, and the people who are running this make lots of money. And they see this as an opportunity to do the same thing with healthcare. 95% of what we see in the health room is not billable. And the billable medications that we give, we are already funding through Access with our jobs that we do the billing for. So the district is seeing this as a solution. They're embarrassed. They're ashamed what happened with LaPortia, and they want to pretend like they're fixing it. And they're pretending by saying we're going to outsource. So for them it's a win-win because they get rid of union positions and they get in an organization that's going to tout how wonderful they are. Now think about it. Children coming to the nurse to get immunizations, to get physical exams, what's happening to their academics? Haidt claims that he wants to have excellence in the schools academically. You can't do that when you have the nurse and the nurse's office as the healthcare center. The proposals that they're asking for should be done at home, not within the schools.
We're going to continue our program here, hearing from another one of our veteran school nurses, Eileen DeFranco. 20 years ago, Eileen, I knew her before I became a nurse, and she invited me to be a nurse. And I said, oh, I'm not too sure I'm the right person. And she just said, you are the right person, and we need good nurses, and we need you. And I started thinking about it. It was the best decision I ever made to come into the school district. As afflicted as this building is behind us, as imperfect as public education can be, public education is the public. It's all of us. The kind of criticism it gets, I think, sometimes has to do with people's deep sense of whatever about themselves, because we are people, we are professionals, and we live in a very, very real world. And I have fallen in love with public education, and I will not give up on it. Every battle that we fight fundamentally comes down to whether we think that everybody is deserving of a decent education. We're not going to sort and put people into one category and be quite complacent and comfortable and just, you know, feel quite okay about some people getting less than others. We know these children. You get to know them and fall in love, and you cannot step away from the inequity. You cannot step away from the battle. So that's really important. So I thank Eileen DeFranco for that. And the other thing I just want to say, she is the first person who said, we're getting out on the street. That week, December 23rd, when that news came out that our colleagues were laid off and our schools were never going to be the same until they fixed it, she said, well, you know what we have to do? I said, no. She said, we're going out. I said, when? After the vacation? She goes, we don't have time for that. We're going out this week. I said, oh.
We thought it was once.
Huh?
We thought it was going to be once.
We thought it was once. It was 28 degrees and snowing, and Eileen, asking no one's opinion,
Yep.
she said, I got to tell you this, she tells the group of about 50 people, she goes, and we're not stopping until they fix this. We'll be back next Wednesday. And I actually took issue with her later. I said, you didn't even ask what we thought. And here's what she said. It was a great line. She said, well, I'll be back next Wednesday. It didn't bother her if she were standing here by herself, because she is a principled person. She doesn't ask people's opinion. She does what's the right thing to do. She's taught us a lot, and she is retiring, and I am so sorry to see her go, but she's not going too far. We're going to find her, and she's not going to leave this battle with us. So, and she's a fabulous writer, and she's going to tell us just why this plan, this model, is just like comparing apples and oranges. It just makes no sense. So let's hear from Eileen.
Well, after taking on the Catholic Church for about the last 2 decades, 440 is a piece of cake. So, yes, I am a veteran. I've worked for the school district for almost 25 and a half years. And I have to say that I have loved my job. I've loved every day that I've come to work. I've loved the children. I've treated them like, my mission was to treat all of the children in the school district like I treated my own children. So what that meant was, when they misbehaved, I sometimes say to them, I'm going to smack you silly. And of course they know that I'm kidding. But anyway, at the Nurses PD on Tuesday, one of the speakers was talking about the ambassador to the UN and the efforts that were made to combat Ebola in Africa. And her comment was, Samantha Power, the ambassador to the UN, her comment was, in order to solve a crisis, you have to go into the field. You have to be on the ground in order to solve it. And the very thing that has never been done, as far as I know, is neither Dr. Height nor Karen Lynch has ever walked into a health room. The nurses that are here, has either one of them ever walked into your health room?
Never.
And a superintendent has never walked into my health room, except for Karen Kolsky. In the beginning of the year, she walked in very nicely and said, thank you for your service. Now, if they had been in Joanne Coleman's office last week, where's Joanne Coleman? She had one child having cluster seizures, another one having an asthma attack, and a third vomiting on the floor simultaneously. If they had come to my office last week, I wouldn't have been there because one of our staff members had a seizure in the stairwell. Now, there are thousands and thousands of stories in the district that the nurses could tell that neither Dr. Height nor Karen Lynch have chosen to hear. And therefore, they have neglected to understand what constitutes school nursing. So if they had done any study about school nursing, they would have known that about 20 years ago, there was a whole passel of school-based clinics in schools. All of which were supposed to boost achievement and academics, none of which did, and in a few years they were all closed. Why? Because aside from emergencies which require 911, whether you're in a clinic or the school nurse's office, school children do not need to see a doctor when they have to go to the bathroom, and that's why their stomach hurts. Or if they have a headache because they didn't eat their breakfast, or if they need a Band-Aid. When I started out working for the school district, I worked at Olney Elementary, and a lot of my students were non-English speaking or the children of the working poor, and finding doctors was really difficult. So I had a chance to transfer to Stetson Middle School, where there was going to be a school-based clinic. Well, I was so psyched. I thought, all of my problems will be solved. All of my children will be able to get the health care that they need. Well, I don't want to lose my track. You know, when you get old, you lose your track. So I was at Stetson for 1 week, and I realized that Kensington was inundated with health care. There was Maria de los Santos right down the street. There was St. Christopher's right around the corner, and any number of neighborhood providers, all of whom accepted medical assistance. What happened was, no one did a needs assessment. You know the data that Jerry and Helen talked about? No one had done a needs assessment. They just jumped right into the school-based clinic bandwagon. The reality is that if people don't need something, they will not use it. The kids and the families in Kensington neither wanted nor needed a school-based clinic, and they did not use it. The other issue is, and was, that consent forms were not signed. So therefore, there were no billable, or very few billable incidents. I also participated with another group back in the 90s, a group of do-gooders, and I always consider myself a do-gooder and a left-wing commie pinko. So we had this grand idea that we were going to have some kind of health something or other in Olney for these people. It was the time of the Family Resource Network. You all remember Family Resource Network, right? I wonder if Dr. Height and Karen Lynch know anything about the Family Resource Network. So anyway, being the good health professionals we were, we did a needs assessment. So we had the stakeholders from the community come and talk to us. And guess what? Health was not 1 on the list. It was not 2 on the list. It was 10 on the list. What they were concerned with was violence in their neighborhood. They felt that they had enough health care and they didn't need any more. So we disbanded. We didn't insist that they accept our suggestion that they needed health care. So So I have a question for the people at 440. Have they done a needs assessment? Have they consulted parents? Where is their data? Which Helen and Jerry asked. And has anyone asked the nurses what they think we should do? And we all know the answers. Interestingly enough, there was a GAO report that comes from the federal government that came out in the late 1990s that did a study of all these clinics in the 1990s. And what they said was the school-based clinics did nothing to boost achievement or attendance. And they were basically a bust. But guess what? Now that people think they can bill for services, all of a sudden, school-based clinics are the best thing since sliced bread. Interestingly enough, I had a conversation with a young lady. She identified herself as coming from a Ready clinic. And I said, what's a Ready clinic? She said, Rite Aid. Not only is CVS going to have a bunch of clinics, the Rite Aid is going to have clinics. So we're going to have a CVS clinic down the street. We're going to have a Rite Aid clinic around the corner. And then we're going to have a school-based clinic. And what do we talk about? Scarce healthcare dollars? This is what happens. People jump on the bandwagon and they do not do their homework. So those who do not read history and chose to ignore it because their idea is better, they choose to repeat it. And what's happening is our kids they're going to be used by the insurance as an experiment, as other people have said, and as a source of funding. So, just my thoughts. I guess this is my swan song. But I'll come back. If we decide to do this every week, you know I'll be back here. I'll have my words and whatever. So thank you.
Thank you, Eileen. So we're going to wrap up soon, but I do want to give anyone else who may want to have something to say an opportunity at the mic. We really want to make this a grassroots effort, and we don't want everybody to be heard. So if anybody wants to speak, please, Diane. Oh my, another fabulous PFT retiree, Diane Mooney. We just absolutely love her. She is everywhere where an issue of justice is being dealt with, and we're so happy to see you. Thanks.
Even in jail.
Thank you. I try everywhere. This is my chance. Since you started talking about the dental clinic, a few months ago they had a meeting here at 440 about more services in the school. I can't remember how they titled it or anything. I came in and I was assigned to a table. I knew a couple people at the table, and I knew the leader. And there was a guy sitting there in a suit. He looked much better than any of the rest of us looked. He was dressed better anyhow. And I didn't know who he was or anything. And they went around the table and they asked something, what kind of services would kids need in school? What kind of health services? And I spoke and I said, I'm going to take a little different angle on this, because I think something that's very, very important in the community is $15 an hour for everybody that works for a living, and paid sick leave. Well, Mr. Suit absolutely disagreed with that. He did everything but throw a temper tantrum, and I couldn't figure out why. Well, in the second half of the program, they had a panel. And there up in front is the Suit. He's the guy that runs the dental clinics. To me, that was an expose that he doesn't want to pay his workers a decent living, and they probably don't get paid sick leave either. So I think we have to be, for all the reasons that have been said here today, plus the reason that people are going to lose their jobs in this school. Not just nurses, but people that are assistants in the school, the paraprofessionals. They're going to be replaced by somebody from one of these corporations that pays dirt low wages and shouldn't be allowed to walk the face of the earth. And they should be in jail, because privatization is theft. They're stealing public money and putting it into the private sector to no good use except to boost the stock market. Thank you very much. I'm enjoying being retired. I enjoy being a school nurse.
Thank you, Diane. Anybody else want to speak? Oh, come on up.
I'm Michelle Perloff. I'm one of the nurses who was laid off on December 23rd, 2011, and I was laid off for a year and a half. I'm not a pawn. I'm a person who has real responsibilities. I'm a young widow, and I have 3 kids. I take my job very seriously. I've been a nurse for over 20 years, and I want to just clarify that we are health advocates. We are here as health promotion people. Our offices are called health rooms, and we are here to advocate for the children in the school district. We're not just people who put Band-Aids on. We do that, but we do a lot of other things too. And I want to be taken seriously as a professional with my colleagues in my job that I do take seriously. I hope everyone who's listening behind us will take that more seriously.
Hi, I'm Marilyn Goins. I've been a school nurse for 14 years, and before that I was a school teacher for 7+. Those people that do not know history are forced to relive it. But can we afford it? Now, one of my favorite subjects is history. And we'd love to talk about the 15th century and the 16th century. There was a king called Henry VIII. Now, you know, we think of jolly old Hal and how funny he was and how his wives, some of them died, some of them had lost their heads. But under his administration, we had the biggest transfer of property to the crown. He made people rich. He made the aristocracy rich. And I say, let's look at the buildings, the empty buildings. I live in Germantown. I passed the empty Germantown High School and the empty Fulton. We see public things that were purchased for by the public going to be sold for $1 to private industry, private businessmen. That's a transfer of wealth. Let's call it what it is.
That's right.
I'm a taxpayer. We're all taxpayers here. But we're not benefiting from the private transfer of funds.
Thank you so very much for wrapping up. I think did you have something to say?
I need everybody here next week for the number. I need everybody next week.
Are you pulling an Eileen DeFranco on me and telling me I'll be back?
Yeah.
Okay, you heard it. That's Lisa Haver. We'll talk later, but mark your calendars for next week and check your emails and your social media and we'll figure out what's going on. But we are not letting this issue die. We're going to take advantage, really, it's a moment in Philadelphia that those of us who've spent our lives here have been waiting for a long time. It's opening up a window of hope for all of us that we can see things in new way and envision the kind of schools that each and every one of us would want our kids, our grandchildren, our neighbors to go to, and not start at age 2 trying to dig and crawl our way to the better school where we can then sit back and not really give a damn who's in those other schools. We're looking for something different. I've heard it from Helen, I've heard it from Jim Kenney and the other candidates, and we're really excited about this, and maybe it'll help us catapult this energy of our communities and all of our union members and our various unions in the city to see one issue for this one city, and we'll work together. So let's hope maybe we will see each other next week. But I'm hoping some of you will have a few minutes to go into SRC. More fun lies ahead. If you've never treated yourself, just get in and get a good seat and kick back. Thank you very much. Yes, just a minute. It's never over till Lisa has a word, and that's good.
Because I have to say that one of the most brilliant things I've ever seen in the Inquirer was Eileen DeFranco's article, op-ed, about those people inside, and it was called "The Lowest Performing Seats in the District." And I could not, you know, we sit here watching month after month, and I don't think you did it justice, Eileen. I had to say that. So we really need everybody here. There is another one next week. There's usually only one a month, but now they're trying to ram through this budget, and that's all I'm going to say.
Okay. Thank you very much for coming. Thank you.